Hello, my name is Ollie, I'm one of the doctors, and welcome back to my YouTube channel. As you may or may not have noticed, I've got a new job, and that job is allegedly junior doctor. So in this video, I thought it would be a good opportunity to explain what exactly a junior doctor is, a bit about how medical training works for those of you that are confused as to exactly the stage that I'm at, and specifically I'm going to tell you about my job, or what my job will be for the next couple of years. But before we jump into things today, guys, standard beg to hit that like button, leave a comment if you so wish, and make sure you subscribe to the channel, hitting that little notification bell to make sure that you don't miss any updates. But the first thing that we need to understand about the term junior doctor is that it is actually a very, very broad term that encompasses literally any doctor working in the NHS that is not either a GP or a consultant. That is, any doctor that has not yet completed specialty training. So what this means in reality is that, just like me, someone who is fresh out of medical school is classed as a very junior doctor. Equally, you could also have somebody who is 20 years out of medical school with tons and tons of clinical experience under their belt, but because they haven't finished specialty training yet, they would still be, in technical terms, a junior doctor. This is why the term is often a bit confusing, and it's very much a catch-all that doesn't necessarily tell you anything useful. But with that definition out of the way, where am I? Well, I am now in the shadowing period, so I'm in post, but my contract hasn't officially started yet. The shadowing period that comes before becoming a foundation doctor, the most junior of junior doctors that it's possible to be. So at this stage, it is assumed that you have the kind of barest minimum of clinical knowledge that is required to pass medical school, although obviously that is a considerable amount of knowledge. Normally the course takes 5 years of study to achieve. In my case, I did a graduate entry medicine program, so if you have a degree before, such as I did in molecular biology, a bachelor's of science, you can actually compress the course into 4 years rather than 5. But to get to this stage, I have done 7 years of continuous university level study and turned 25 just before graduating from medical school. So then when you leave medical school and go out into the big wide world, you enter what is called the foundation program, which is a 2-year clinical program. You are being paid during this time. It is a full-time job. As I say, you are a junior doctor, but this 2-year program is intended to do a few things. One of those is certify you for independent practice, further build on the skills and knowledge that you already have from medical school, and thirdly, prepare you to undertake specialty training in whatever specialty you fancy doing. By and large, although there are some exceptions, it consists of 6 different jobs which you will work for 4 months each over 2 years. The new foundation doctors rotate in on the 4th of August every year, so on the 4th of August 2021, a couple of weeks from now, I will formally come into post as a new foundation doctor, and in theory I will be finished with the foundation program, assuming all goes well, in August of 2023. So I'd be 27 finishing the foundation program. I could be 30 provisionally as a newly qualified GP, but let's say instead that I wanted to be a cardiologist, a heart doctor, then I would apply for what's called internal medical training, which is a generalist training program that prepares you to be a medicine doctor, a hospital doctor, which usually takes 3 years, after which I would then be able to apply to cardiology specialty training, which would be a further several more years dedicated specifically to cardiology, after which I could apply for a job as a consultant cardiologist. Likewise, if I wanted to be a surgeon, I could apply after the foundation program for core surgical training, the equivalent to the medical pathway before, but this time for surgery. So I would do 2 or 3 years of core generalist training, and then I would undertake 3 or 4 more years dedicated to a particular surgical specialty, once again at the end of which you would be a consultant surgeon. While in specialty training, you are referred to as a specialty registrar, or colloquially a reg. Basically on the ward, this is someone who knows what they're doing, or at least ought to really know what they're doing. And as I say, when this pathway finishes, you will become a consultant, although again, there's obviously many years are going to be spent on one of these training pathways. Until you are a consultant or a GP, you are are still a junior doctor, technically speaking. So coming back to me, I am currently in the post I am now, known as a Foundation 1 doctor, an F1, an FY1, Foundation Year 1, or in old money, a house officer or a houseman. This is the lowest level of doctor that you can work as in the NHS. It's the introductory role to clinical medicine, and we will usually be responsible, along with the FY2s, those a year ahead of me, or senior house officer, SHO, as well as any other staff that are there, such as PAs, nurses, midwives, healthcare assistants, and so on. It is this group of people that's usually responsible for the day-to-day runnings of the ward, basically keeping all the patients alive and happy while they're in hospital receiving the treatment that they need. So I said before that I'm in a shadowing period at the moment, and what this means is that I officially at the moment have no responsibility on the ward. So I'm basically in the process of learning in this very introductory period what actually happens day to day on my particular unit, and what my roles and responsibilities will be as the F1 on the ward, at least when I'm rotated to be there, because like I'm sure I've said many times before, and you will hear a lot in a hospital, medical school doesn't actually prepare you in any way to be a doctor, it simply prepares you to pass exams. I'm very quickly realizing that actually working and practicing as a doctor is something that you can only really learn on the job when you have responsibility and you're making clinical decisions. But for example, it's looking like my day-to-day on the unit that I'm on will include things like doing the ward round with one of the registrars and documenting everything that happens. And while that's going on, we'll assemble a jobs list for every patient that we see. So they might need changes to their medication, they might need a particular scan, they might need things adjusting, blood tests doing, and so on. They may need a discharge letter writing, or they may need to be reviewed by either a specialist such as a dietitian or a tissue viability nurse, or a review from someone in a different specialty. So all of these jobs get noted down into a big list, and then it's looking like the afternoon at the moment is simply actioning all of the items on this list, which can potentially be very long, as well as dealing with new jobs and new problems that need to be solved as they appear. So naturally, you can see that the junior doctors are going to be kept very, very busy throughout the day. So specifically, what area of medicine am I working in as a newly qualified doctor? Well, it's actually a lesser known specialty. I think it's more a subspecialty known as HPB, or hepatopancreaticobiliary surgery. The letters HPB each kind of represent a slightly different part of the body, but all of these come together under one department. So hepato, problems of the liver; pancreatico, problems of the pancreas; biliary, problems with the biliary system, the bile ducts and the gallbladder. Because these things are all plumbed fairly directly together, they're dealt with as one unit, surgically speaking. And the hospital in which I'm working is also a specialist transplant centre. It's a liver unit, which is why the patients here need quite specialist care. So day to day I'll be working on this HPB surgical unit as one of the surgical FY1s, but then we have what are known as on-calls as well, where you're responsible for more areas of the hospital, and my on-calls are actually really broad. So they'll be covering general surgery, which includes not just HPB, but gastric problems, colorectal problems, basically anything in the abdomen, as well as vascular surgery and orthopedics as well, which is a huge potential range of cases. So I'm working that job from August through to December, at which point I will rotate into a completely different area of medicine. In my specific case, I'll be moving on to what's called an academic block, which we'll talk about this in more detail in other videos, but basically what it means is that I have contractually protected time. That is, people aren't allowed to ask me to do clinical work in other areas. This time is built into my contract. This is protected for development in research, leadership, or education research, as is the case for my post, because I have the one medical education research academic post in the northeast of England. I was very lucky to get it, but it is a super flexible job. This is part of what's called the Academic Foundation Programme, but in most cases up and down the country, these are very, very flexible programs, like I say, that really allow you to control your own time. So what I'm going to be doing in my academic blocks is spending time doing research in medical education, with Newcastle being a nationally known kind of excellent place for teaching and education research, and I'm going to be spending time in neurosurgery as well. which is my primary clinical interest, because med-ed and neurosurgery are basically the two directions in which I'd like to push my career. So once I've done the academic block, which should finish around April, from April until August, I'll then be working in my final job of FY1, which is acute medicine. And this is a department full of patients who need really urgent and acute care, as the name might suggest, after they've been brought in from the emergency department and it's been decided that they need to be admitted to hospital and they need looking after in the immediate setting. Maybe before the input from specialists, they go to acute medicine. So that's going to be a really good job for skill building and looking after critically unwell patients. So then in August of next year, that is August 2022, I will become an FY2, a Foundation Year 2 doctor, or an SHO, a Senior House Officer. And again, I will rotate through 3 more jobs. The first of those is going to be a neurology block, neurosciences. That is clinical management of conditions affecting the brain and spine. So you might think of things like Parkinson's disease, strokes, dementia, meningitis, things like that, which I'm really looking forward to. Again, I am trying for a career in neurosurgery, so really good functional understanding of neurology is going to be really useful for that. Then in December 2022, I will actually move on to a second academic block. At the Northeast, peculiarly, is the only place in the entire UK where you get 2 academic rotations, which is a really good opportunity as far as I'm concerned. And then in April 2023, I will commence my final rotation as a foundation doctor, all going well of course, in psychiatry as well, which I am actually really looking forward to, because I don't think it gets enough appreciation for what it is, and you really commonly see psychiatric problems and psychiatric elements bleeding over into other areas of medicine. For example, in emergency and acute medicine, a lot of the presentations are driven by psychiatric causes and settings rather than just the organic causing. So psychiatry seeks to broadly deal with these problems of the mind. Now, just as I'm bringing this video to a close, a lot of you have been asking in the DMs whether or not I will be continuing this channel now that I've finished medical school and I'm moving into life as a junior doctor. And of course the answer to that is a resounding yes. I wouldn't give this up for the world. I'll be doing my absolute best to keep to 2 uploads a week, Wednesdays and Saturdays. Although there is obviously going to be a shift in my content. I am going to be moving away, at least temporarily, from admissions and WP content, because I've covered a lot of it already. There will come a time in which I want to remake a lot of it, although that's likely going to have to wait until my academic blocks, where I've got a significant amount more time to work on things like that. But we're going to move more to med-ed, that is medical education, content aimed at preclinical and clinical medical students and physician associates, as well as obviously nurses and allied health professionals that want to learn a bit more too, as well as obviously vlogging my development as a junior doctor, because just as my perspectives and thoughts on things actually really changed significantly during medical school as I gained more knowledge and became more confident, if not necessarily more competent along with that, I'm fully expecting the same thing to happen, potentially more quickly, as I get used to being a junior doctor and moving through the different jobs. And that's something that I think is really important to capture as well, because this whole channel, more than anything, was about capturing the journey. You can see how I change and have changed, going from someone who had just got into medical school, someone who has gone through the preclinical and the clinical years, and then through finals and past finals, and is now becoming a junior doctor. I think it's really important to capture that chronology, and of course that's only going to continue as long as I'm able to keep making videos. So that's where we'll wrap. Thank you so much for watching, guys. As always, please be sure to hit that like button for me, leave a comment, subscribe, and don't forget to go and check out ollieburton.com, where you can find my full blog and more videos just like this one. Take care, and I'll see you next time.